That is a complex question. Um, there's the obvious ways, which are, it makes healthcare more accessible and affordable if used correctly. So the fact that you don't have to go to the doctor to be seen. Now the doctor can come to you virtually. That changes a lot. Changes a lot in terms of how we deliver care to people. It can help solve care shortages, right? So our rural areas are constantly struggling to find doctors. But if you can deliver the doctor virtually to the rural area, then you don't necessarily need to be stuck without a doctor for a long time, waiting for somebody to decide to move to your community. Instead, you can just have them be there virtually, regardless of where it is they happen to live. And I use rural areas, but there are many, urban and suburban areas that have the same exact problems, right? They can't get any doctors around, or they have a shortage of doctors relative to the need. And virtual gives you a chance to address those problems very effectively and much more cost effectively. So there's that element of it. If you take doing visits with people, for example, in their home, there are things that you can learn about them. So let's say you're seeing them virtually in their home. There's things you can learn about them from seeing their living environment that you might not otherwise know. This can fall under what we now call social determinants of health, right? But there are things like that where you realize, hey, this person's living condition really needs to be addressed. No wonder we're not making progress on their diabetes, right? It doesn't look like they can afford food, right? It's much less these incredibly overpriced diabetic drugs that we're trying to have them take. So there's things like that you can get from visiting someone where they are that you may not be able to get when they come to you, and all those things are hidden. There's things that you can get. So, for example, we will see, if you use the aspect of telemedicine that is remote patient monitoring, right? So monitoring vital signs and having that be automatically uploaded to the cloud by a device, rather than waiting for the patient to come in 3 months later with a list of their blood pressure or their pulse or whatever it was. There are trends that you can begin to pick, and the same is true for blood sugars, right? There are trends that you can begin to pick up on or pick out much earlier than you might have otherwise. And so maybe, for example, you see their blood pressure spiking, and you can intervene on that before they end up in the emergency room with an incredibly high blood pressure and a headache, right? So therefore, you have just prevented an ER visit or possibly even a hospital stay simply by monitoring the patient's vital signs at a time when normally, under normal medical conditions or prior medical conditions, you would not have been able to do that, right? So there's a lot of things like that that are potentially transformative. The secondary aspect is things like the cost of care. There are not that many doctors relative to the population, so they cost a lot of money. Well, an obvious problem is if I have 5 small hospitals, right? I need to put a doctor in the old system. I need to put a doctor at all these hospitals, at least theoretically, right? I need a doctor in all these places, which means I need to pay a full doctor's salary, maybe even more than that if I'm geographically remote, right? To get a doctor to come out to my place.